All right, so we start with aphasias now. Now, just a heads up, what is the meaning of an aphasia? An aphasia is basically a language problem, right? So the patient cannot speak properly. They sometimes they can speak, sometimes they can understand speech, sometimes they can read, and sometimes they can write. So aphasia is basically a language problem, and it is related to the speaking. It is related to understanding the speech, which we basically call comprehension. It is related to reading, right? And then it is related to writing. So we're going to understand one by one. Remember that aphasia is not a problem with the muscles. The lesion is in the dominant cerebral hemisphere, which is almost always the left hemisphere for people, right? Now, dysarthria is something different. Dysarthria is not aphasia. Dysarthria means that the patient knows exactly what they want to say, but they cannot move the lips, tongue, palate, or vocal muscles properly. So an example would be a stroke affecting the corticobulbar tract, or Parkinson disease, or myasthenia gravis, or Bell's palsy, right? These are examples where you have dysarthria, where the patient knows exactly what they want to say, but they can't move the lips or tongue or palate or vocal muscles properly. Language is completely normal here, but aphasia is where the language deficit is the problem, right? Now, there are two questions you always ask in aphasia. So you ask if the speech is fluent or not. So there's a fluent speech aphasia and there's a non-fluent speech aphasia, okay? And then there's the other question is, do they understand language? So you're trying to understand comprehension. There's a good comprehension and there's a poor comprehension, right? There are two kind of comprehension patterns. So if you say close your eyes, right? So if you say close your eyes and can they obey? And if they obey, this means the comprehension part is intact, right? And if you say, can they produce long, smooth sentences, or do they struggle to get words out? So this is how you know if it's fluent, they can speak long, smooth sentences. But if it's struggling to get words out, then that is non-fluent aphasia, right? These two questions give almost every aphasia the clue you want to hear. Now, good comprehension and fluent speech is basically conduction aphasia, right? And then we have another aphasia where there's poor comprehension and fluent speech, right? You can't understand, but the speech is fluent, right? That's Wernicke aphasia and transcortical sensory aphasia. We'll see what these are later on. Okay, and then there's good comprehension and non-fluent speech, that's Broca's and transcortical motor aphasia. And there's poor comprehension and non-fluent speech, and that's transcortical mixed aphasia, right? Okay, so first of all, we look at the aphasia. The Broca's and Wernicke is very, very commonly tested. So the Broca aphasia is basically, the location of the Broca's aphasia is basically the inferior frontal gyrus. This is the Broca area. It's usually supplied by the superior division of the left middle cerebral artery, right? So the Broca aphasia is a problem with the inferior frontal gyrus, the Broca area, and this is usually supplied by the superior division of the left middle cerebral artery. The function is that Broca converts thoughts into spoken language. Think of him, or think of the Brocas basically as the brain speech producer. The patient understands you here, right? But it's very difficult to get the words out. So Brocas is basically the patient can understand, but they can't speak properly. So you ask the patient about what happened in his accident, and he'll be like, car crash, yesterday. So very few words, very slow. That's broken speech, but the patient becomes frustrated because they know what they want to say and the insight is preserved. And that frustration is like this exam favorite, right? So the comprehension is good. The spooch, not spooch, speech. The speech is poor and it's non-fluent. The repetition is also poor. We also see something as repetition in aphasia. So if you say something and you ask the patient to repeat, that there's poor repetition in Broca's, conduction, and Wernicke. And there's good repetition in all these cortical problems, these transcortical problems, right? So you have bad repetition in Broca's. The writing is also poor, by the way. Okay, so Broca's is broken speech. Then we move on to Wernicke aphasia. Aphasia is basically receptive aphasia, right? So you have poor comprehension and fluent speech. We usually call this the word salad. The location is the posterior superior temporal gyrus. This is usually supplied by the inferior division of the left middle cerebral artery. So Wernicke is the inferior division of the left cerebral artery, and Broca is the superior division of the left middle cerebral artery. Wernicke The patient talks beautifully. He's very fluent. Grammar is perfect. Flow is excellent, but nothing makes sense. The television was running inside my umbrella because happiness is blue. ठीक है. So this is called word salad. मतलब कैसे ही television was running inside my umbrella and कैसे ही happiness is blue. So you ask the patient to touch their nose and the patient can't touch their nose. So they can't really, there's no comprehension there. The speech is fluent, the comprehension is very poor, right? And the insight is absent. They don't realize anything is wrong. This is a very exam favorite clue. And poor repetition and writing is fluent, but it's meaningless. ठीक है? So moving on to conduction aphasia. Conduction aphasia क्या होता है? This is basically now suppose Broca and Wernicke are both normal, but the wire connecting them is cut. So we were talked about that arcuate fasciculus, right? The arcuate fasciculus or the association fibers are basically connecting these Broca and Wernicke together. So the wire connecting them is cut. Now what happens? The patient understands, patient speaks fluently but cannot repeat. ठीक है? Example, the doctor says, say no if and or buts. So the patient says no and no. Why? Because the message cannot travel from comprehension center to speech center. So the clinical picture is where just speech is fluent, the understanding is good, but the repetition is very bad because there's no connection to the Broca and Wernicke. This is almost always the exam clue that there is no connection between the two. Okay. Global aphasia, when we talk about the global aphasia, basically, global aphasia, now imagine this global aphasia is when the Broca and Wernicke are both affected. Imagine a huge medial cerebral artery stroke. Both Broca and Wernicke both die. Everything is lost. Patient cannot speak, patient cannot understand, patient cannot repeat, patient cannot read, and patient cannot write. This is usually caused by a very large middle cerebral artery infarct. Then we have the transcortical motor aphasia. Okay, don't get confused. The transcortical motor aphasia sounds very confusing, but it's not very confusing. So you have to think that the Broca itself survives, the cortex around it dies. So the Broca becomes isolated. I'll repeat it again. The Broca itself survives, it's living, but the cortex around the Broca is dead. So Broca itself becomes isolated. The patient cannot generate spontaneous speech. Looks like a Broca aphasia, right? So the patient cannot generate spontaneous speech, and this looks like Broca aphasia, but repetition is preserved. Patient cannot understand spontaneous speech. It looks like Broca aphasia, but repetition is preserved. So you're like, that's interesting. Why? Because the Broca is still intact. There's less, the speech is reduced here. There's non-fluent speech, right? The speech is reduced, the comprehension is good, and the repetition is good. So the only difference between Broca aphasia and transcortical motor aphasia is the fact that in Broca aphasia you have poor repetition, and in transcortical motor aphasia you have good repetition. So then we look at the transcortical sensory aphasia. This is the mirror image of the transcortical motor aphasia. So the Wernicke survives, but surrounding the Wernicke, all the other cortex is dead. So the patient cannot understand but speaks fluently. But repetition again remains intact. It looks like Wernicke, except repetition is preserved. The only difference between Broca and this transcortical motor and the Wernicke and then transcortical. Okay, so the transcortical mixed aphasia. Okay, so the transcortical sensory aphasia and Wernicke, the only difference is the repetition is preserved in the transcortical sensory one, and the transcortical motor and Broca, the only difference is that in the transcortical motor aphasia, the repetition is preserved, right? So that is something that will tell you if it's Broca or transcortical motor or if it's Wernicke and transcortical sensory, right? Okay, moving on to this last one. This is the transcortical mixed aphasia. Right? Transcortical mixed aphasia is a watershed infarct. I told you the watershed areas, right? You should go back and look at the watershed areas. This is when two arteries are supplying a vulnerable area where the blood supply is coming from two arteries, so it's vulnerable to ischemia, right? So watershed infarct gives you a transcortical mixed aphasia. The Broca is intact, the Wernicke is intact, the arcuate fasciculus is intact, right? So everything around them dies, but the Broca is okay, the Wernicke is okay, the arcuate fasciculus between them is okay, right? Patient can repeat everything, patient cannot understand. Patient cannot understand, but he can repeat everything. He cannot generate meaningful speech. This is called isolation aphasia. So there's non-fluent speech and there's poor comprehension. Okay. And this is called basically, but the patient can repeat everything, right? And this is called isolation aphasia. This is transcortical mixed aphasia. I will stop the aphasia table now here and we will continue with the aneurysms in the next video. Right? I hope this was clear to you guys.